I'm going to summarize our cost-effectiveness analysis of non-invasive testing in low-risk chest pain published in JAMA Network Open. 3 decades ago, most patients with suspected stable coronary artery disease presented with typical chest pain induced by exercise and relieved with nitroglycerin. At the time, functional testing for myocardial ischemia had a high positivity rate, and the belief was that revascularization of coronary stenosis will prolong lives. Today, however, typical symptoms of obstructive coronary artery disease are uncommon, and its clinical presentation is rather atypical due to improved lifestyle and prevention with statin therapy. With this, functional testing for myocardial ischemia has become less effective with a low positivity rate. Moreover, based on randomized trials, today we know that treating coronary artery disease with optimal medical therapy is as good as revascularization. Since the early 2000s, anatomical testing of coronary artery disease with coronary CT angiography allows the non-invasive visualization of coronary artery plaques. The detection of the presence and extent of underlying coronary artery disease further allows tailoring preventive medical therapy, for example with statins. Yet, today, anatomical testing is the test of choice in less than 5% of the patients with suspected obstructive CAD in the United States. Therefore, we conducted a cost-effectiveness analysis to identify what is the most useful initial test for patients with the suspicion for obstructive coronary artery disease in 2020. We performed a cost-effectiveness analysis using real-world patients enrolled in the PROMISE trial to determine whether anatomical versus functional assessment is the best non-invasive testing strategy for patients with suspected obstructive coronary artery disease. We determined lifetime rates of coronary revascularization and cardiovascular events, as well as lifetime costs and cost-effectiveness. Over a lifetime, anatomical testing had a lower rate of revascularization, lower rate of cardiovascular events, and was cheaper, which results were observed due to the ability to tailor statin therapy to the presence and extent of coronary artery disease. Therefore, overall, our analysis suggests that anatomic first strategies are cost-effective over a lifetime as compared to functional testing and may present a favorable initial diagnostic option in the evaluation of low-risk stable chest pain. Thank you so much for listening.